If you're dealing with mid or upper back pain after breast cancer treatment, check out these 3 easy stretches that can help bring you relief, and all you need is a comfortable chair to sit in. I'm Dr. Alex Hill, and I'm a board-certified physical therapist. I specialize in women's health and oncology. Make sure that you subscribe for more cancer survivorship videos. Always check with your oncology and medical team first before starting any new exercise program. If you've had surgery or radiation therapy, start with smaller ranges first and gradually increase that movement. If you have any pain during these movements, decrease the intensity or stop the exercise. If the pain doesn't get better after improving your posture, your mobility, then make sure that you check in with your medical team. For the 3 exercises that we're going through in this video, we're going to do about 10 movements for each of them. You can do these a couple times a day or anytime that you start to feel that pain starting to come on. The more often you do these throughout the day, the better. You don't want to only do them when you already have the pain. All right, let's get you some relief. The first stretch is going to be for your mid and upper back extension. So with this stretch, this is going to really help open up the chest and mobilize the mid back. So you're first going to sit tall in your chair with your feet flat on the floor and your knees bent at about 90 degrees. You're going to place your hands on your thighs just above your knees. You're going to breathe in deeply. And as you breathe out, you're going to gently press into your upper thigh. Start with your chest lifting up and back as you press down into your thigh and lift your chin up towards the ceiling. You should feel a stretch in the front of your chest, maybe up into the neck, as well as in your mid back. So again, you're gonna start with your hands at your thighs. Breathe in, breathe out as you gently press into your thigh, lift your chest up and back, breathe out and lift your chin. Breathe in, come back down. Breathe out, lift and lengthen. Go all the way back as far as what's comfortable. Breathe in on the way back down. So as you do these movements, you can do them with your breath. So you're breathing out as you extend back. Really get all of that air out and then breathe in on the way back down. The more that you pull back or give pressure down at your thighs, the more you'll really get that stretch into the mid back. Breathe in, breathe out. Breathe in, breathe out. Really lift that chest up, give some of that pressure into the thighs. The nice thing about this stretch and movement is this also helps to stimulate the lymphatic system as you start to move the trunk and with that deep breathing. Each time that you do this, you might feel that you can get back even a little bit more, feel a little bit more stretch. Excellent job. The next exercise is going to be chest opening with your arms going out to the sides. If you have pain with bringing your arms up to shoulder height, you can keep them lower. That's okay. Just go with what's comfortable for you. So what you're going to do is sit, again, tall in your chair, feet flat on the floor. You're going to bend your elbows to about 90 degrees, keeping your arms parallel with the floor and upper forearm in parallel with the wall. You're going to then breathe in first, breathe out as you open up your elbows. You should feel your shoulder blades really coming together at the back. So you're going to, again, breathe in, Breathe out and open up. Breathe in, come forward. Breathe out, open up. So you should feel a nice big stretch at your chest. And again, really opening up that back and squeezing those shoulder blades together at the back. Breathe in, come forward. Breathe out, open up. Breathe in. Breathe out. Excellent job. Again, just like with the first exercise, as you open up each time, you might find you can get a little bit farther back than the times before. If you need to start out just right here and you're just getting to about your shoulder versus getting back behind your shoulder with your elbows, that's okay. Just start in that comfortable range. Open up the chest, bring those elbows back, squeeze the shoulder blades together. Breathe in, come forward. Breathe out, open up. Breathe in, come forward. Really breathe into that chest, into those ribs. Exhale all the way out. Really squeeze those shoulder blades together. As you do this exercise, make sure that you're not bringing your shoulders up with you. Really push them down to the ground as you open up your arms. All right, for our final stretch, we're gonna be working on rotation. So we worked on extension, really opening up the chest, but now we're gonna work on the spine mobility in more of a rotation. So you're going to have your feet a little bit wider apart than we have. You're then going to place your right forearm against your inside of your right leg, and we're gonna be rotating to the left. So you'll see my hand waving here, that's the side we're moving to. So you're going to, again, gently press into your thigh, and then you're going to open up your left arm back behind you and really reach back. And so we do this movement just like we did with the other exercise with our breath. So go ahead and get into the position. So you're just gonna gently rest your arm onto your thigh, breathe in and breathe out. Breathe in, breathe out. And you can feel that as you kind of press into your right leg, you get a little bit more counter pressure to get a little bit more rotation. If you need to use the thigh to support yourself instead and just have your forearm resting on that leg, that's okay too. So you're gonna breathe out as you go up. Breathe in, come back down. I'm gonna go back down. Breathe in, out as you go up. Breathe in, breathe out. If that's uncomfortable or you have a hard time getting up there, again, go into a range that's more comfortable for you. You can also keep your arm at your shoulder. You breathe in, breathe out. You're just more so moving the elbow. Again, you can keep your hand here at your shoulder, and that's going to be a little bit less of a stretch if going all the way up with the full arm is too much of a stretch. So we'll do that a couple more times. I'm gonna extend my arm again like we have in the original position. Breathe out, push against the leg, breathe out, really get into that rotation. Breathe in on the way down. Again, you'll feel each of these movements, you're gonna get a little bit farther. Breathe in, breathe out. Good, all right. We got the left side, now we gotta do the right side. So we're gonna get up, set up in the same way. So you're gonna have your left arm on the inside of your left knee. Take your right hand, you're gonna start it low. Breathe in, breathe out as you open up. Breathe in, breathe out. Normal to feel one side is a little bit tighter, especially if you only had treatment on one side. That's okay. That's why we're doing both sides. We want to keep everything as mobile and open as we can. Make sure with that arm against the leg here, you're pressing into it, giving that counter force to really get into that spinal rotation. Again, the nice thing with this exercise is besides working on the spine and working on that mobility with the spine, you're also getting a nice big stretch into the chest. You're also working on stimulating that lymphatic system as you move the trunk and you're doing that deep breathing. Just like with the other side, if you need to place your hand at your shoulder and open up from the elbow, that's okay too. Just go with whatever feels most comfortable for you to do. Great job. I hope you found this video helpful to get some more mobility and some stretching and opening into your chest and your mid back. If you found it helpful, please make sure you like it, share it with someone who might benefit, and make sure you subscribe to my channel for more videos on cancer survivorship.